Good evening, everyone. Welcome to today's online international webinar on oral nicotine pouches and public health harms and regulatory insights. Before we start off with the program, there are just few housekeeping rules for everyone. I would request everyone to please switch on their videos and keep yourself muted. If you have any questions, you can put it in the chat box. Uh, would you like to take a group photograph now, or should we?
Yeah.
Yeah.
We
So
can
I'll
take.
just stop share for a second. If everyone can switch on their cameras and give their bright smiles, it'll be lovely.
Yeah. So we have bright spikes.
All right. 1, 2, 3.
Yeah, more, please.
But just one more.
Chanchal Tanga Kusum, you can just switch on your videos, please. Start taking pictures.
Yeah. Okay. All right. Just one more.
Yeah.
Thank you. So yes. Uh, so to kick off this webinar, I would like to call upon Dr. Garima Bhatt, who is from University of York and a research associate at University of York. Ma'am, if you can please give your welcome address.
Thank you. Thank you, Dr. Paridi. And hello, everyone. And a very warm welcome to all of you who have joined us on a Friday evening to our webinar on oral nicotine pouches and public health harms and regulatory insights. This webinar is being hosted by the Tobacco Control section of the Union. Um, Oral nicotine pouches, they are rapidly emerging products in many countries and also raising many new concerns and questions for public health regulation and also tobacco control. While some may argue that they play an important role in harm reduction, but there are also equally, growing concerns about youth uptake, marketing practices, and the lack of long-term evidence on health effects. Today's webinar is going to bring together experts to shed light on these important issues and to discuss how regulators and public health professionals can respond to these new and emerging products. Today's program will begin with a brief overview of what are oral nicotine pouches, followed by a panel discussion, and the panel will explore the potential impact of ONPs on public health, impact of ONPs on health, their availability and marketing, and also different regulatory approaches that are available across countries. Following this, we will be moving on to an interactive question and answer session. And we will also be hearing from a chief guest, followed by concluding remarks. I would encourage all of you to please engage actively and contribute to what promises to be a thought-provoking session. With this, thank you everyone and welcome to the webinar once again. Back to you, Dr. Paridi.
Thank you, ma'am, for your address. I would now like to call upon Dr. Rakesh Gupta, who's the President and Director of Public Health and Public Health at Strategic Institute for Public Health Education and Research, and is also the moderator for today's panel discussion. But before that, we have a small talk from sir. Sir, if you can.
Yeah. So you have to, remove your
Yeah,
slides.
yes, stop sharing. Yes.
So are these visible?
Yes,
I'll
sir.
make it in a.
Yeah, visible.
Right.
Yeah.
Oh, okay. So good evening, all, and thanks for joining. And so we should know about the nicotine pouches. So most of us will be knowing about it, but I still may tell you the nicotine pouches are nicotine tobacco derived or synthetic, and there are filters available. So there may be microcrystalline cellulose, and some sweeteners are added, flavors are added, and preservatives are added to it. And main thing is that they are popular with the kids because of the colorful packaging, small and easy to conceal, and there's flavor and no smoke vapor or spitting is associated with it, and no offensive odor or smell is there. Nicotine pouches, they are small rectangles that are about the size of a chiclet gum. You might have seen it, and they contain nicotine that is either synthetic or derived from nicotine from tobacco, and they are present as tins of 15 to 20 pouches. They may contain as low as 3 or 6 milligram of nicotine per pouch to 13 milligram and as high as 43 milligram pouch. Thank you. So you put them in your mouth, and most commonly they're stuck between your gum and upper or bottom lip. And some sites they tell people to leave it in the mouth for about 15 minutes. Some say it is about half an hour. Some say it is 45 minutes. But there isn't any instruction manual for them. And pouches they have similarities to nicotine gums, which are used for NRT purpose for the tobacco cessation. But there are two basic differences. The Nicorette, they don't taste very good because they don't have flavors. Nicotine pouches, they have appealing flavors. And nicotine is and the Nicorette is an FDA approved smoking cessation tool. Nicotine pouches, which marketed as a healthy alternative to traditional tobacco products, still carrying significant health risks. Nicorette, by Nicorette, I mean all the brands which are used for NRT. So they have actually they are social influencers who may be telling people that these are such a good things to use. There's masculinization of the nicotine pouches, and the popular nicotine pouch brands are Zyn. They may be uh, by the Atria, by the Rug, Velo, and Rush pouches. They are available, and you can see how they are marketed. Then their e-commerce websites are available to sell them. So you can see these e-commerce websites. Uh, Cyril will be telling you more about these things. And then Instagram platforms are available for Rush pouches and Paz and other brands also. So they have their Twitter accounts also. So there are harms associated which may be told by Dr. Sibia in detail. So addiction and dependence is associated with it. Cardiovascular system can be affected. Then respiratory system, cancer, reproductive health can be affected. Oral health problems can be there, and moreover, there can be mental health problems also associated with. Then also there are environmental harms, which will be told by the Dr. Rana. So thank you all. And there's lack of awareness about the health risks of ONPs, and there are challenges in regulation enforcement, need for stronger policies and public awareness campaigns, and there's increased nicotine addiction among the youth. So these are the challenges which are faced by us. So thank you. Thank you. Yes, Paripati, you can carry on.
Thank you, sir, for giving an overview on the oral nicotine pouches. I'll just share my screen.
Yeah.
So before we move on to the panel discussions, I would like to invite Dr. Rakesh again to please introduce our esteemed chairperson and our distinguished panelists. Sir, over to you.
Actually, it's not coming clearly.
Is it?
Now it's clear. Yeah. So we have Dr. PC Gupta with us. He's a mentor to all of us, mostly in public health and especially in tobacco control. He's director of Healis Sekhsaria Institute for Public Health, Navi Mumbai, and he has lot many things to his credits. Next, please. So in the panel discussion, we had the panelists are Dr. Rana Singh. He is Director Tobacco Control, Southeast Asia Vital Strategies. He will be telling us about the global evidence in relation to public health. We have Dr. S.S. Sibia with us. He's MD Medicine. He's Director of the Sibia Medical Center. He'll be telling us about the ONPs and the health harms associated with it. Next, please. We have with us Mr. Cyril Alexander. He'll tell us about the availability and marketing of the ONPs. He's a master in tobacco industry interference in tobacco, e-cigarettes, and these newer products that are like ONPs. And he is state convener of the Tamil Nadu People's Forum for Tobacco Control. We have with us Advocate Narender Ahooja Vivek, who is advocate and ex-state drugs controller, FDA Haryana, and now he's a professor, head legal, BSA Faridabad. He'll be telling us about the nicotine pouches, regulatory approaches across the countries, but focusing on India. Yeah. Next. Yeah, thank you. I think we can start with the discussions.
Yes, sir, we can.
Yeah. So Dr. Rana first. So he'll be telling us about the effects of the.
Okay.
Yeah.
If you have put me as a chairman,
Oh,
let
sure.
me
I'm
start with
sorry. I'm
some
sorry, sir.
remarks.
Yeah, sure.
Because our rest would be panel discussion.
Yeah,
I
yeah.
would not be really interfering.
No,
in
no,
them
no, no,
unless
sir. I'm sorry
asked.
about that. I should have
No, not
invited
at
you.
all. Not at all. Now, I think that this is an extremely important topic for India, this oral nicotine pouches. And the reason is that by now there is a lot of data, a lot of research papers that show that how rapidly and explosively the use of nicotine pouches has increased in especially in the USA. And why within a few years, I mean, it has gone for, you look at the data, 40, 50 times it has gone. Most explosive increase, like at one time it was for Joule, probably even more than that. And what is the reason? And that those have also been analyzed. And the main reason seems to me, looking at the literature, one is the marketing tactic. They are such, well designed marketing techniques, especially appealing to youth and using all the social media and the internet, and specifically targeting youth with names and with activities and interactive activities which youth like. So that is how they are marketing, and the use is increasing. Second point is attractiveness. These nicotine pouches are getting marketed in the most attractive kind of flavors, tastes, and packaging. So they appeal to youth very much. And also many of the youth who are using it, of course, non-users of tobacco in any form, they are new users. And another point that has already come is that they can contain tobacco derived nicotine, or they may also contain synthetic nicotine. And this is an extremely important point because uh, the companies can always circumvent tobacco control regulations because they may say that these products do not contain tobacco or tobacco derived nicotine. Now, what is the situation in India? We have to monitor and see very carefully. And I think this particular webinar will help everyone in understanding what is the situation in India and what can be done further. So I very much welcome this webinar and the panel discussion. And back to you, Rakesh, for questioning all the panel. And I would very much eagerly looking forward to hearing the discussion and their viewpoint. Thank you.
Thank you, Dr. P. Gupta. And in fact, we had on 11th of September, we had a similar kind of discussion on ONPs, but that was focused on India. And Dr. P.C. Gupta helped in framing the recommendations for the Ministry of Health and Family Welfare. So coming to Dr. Rana. So Dr. Rana, will you let us know what are the potential impact of the oral nicotine pouches on public health?
Sir, you are muted.
Yeah.
Yes, thank you. First of all, good evening to all of you. Thanks to Tobacco Control Section of the Union, CIPHER, RCTC, PGIME at Chandigarh for organizing this very, very important webinar on a very important threat to public health. So all the respected speakers, my co-panelists, chairs, and colleagues, thank you very much. Welcome. So you see, I think Dr. Rakesh Gupta has already shared with us about oral nicotine pouch. But because it's first of its kind webinar on our platform, so it's important to understand all the participants who are here. So it's a new class of nicotine products, but it is not something very new. Although it is very recently that its marketing and use has increased. But first pouch was manufactured almost 25 years back in 2000. And then it got registered in various countries in 2008. But its use and its marketing has really gone up in last 5 years. If you see the sales and its marketing as mentioned by Dr. Gupta ji. So how it looks? So it's really nicotine in the form of crystals, a crystalline powder, which is mixed with many other things like flavors. Dr. Gupta mentioned about sweeteners. There are some pH stabilizers. pH is very important as far as nicotine absorption is concerned. So pH stabilizers are also added in those pouches. There are many brands. Few of them has already been shared by Dr. Gupta, out of which Zin is really some very big brand now. Lucy, On. There is Velo, VELO, which is very popular in our neighboring country of Pakistan. There are many other brands which are manufactured in Sweden, so Fox, Days. So just to update you that last week I was in Tamil Nadu and with Mr. Cyril and many other colleagues. So I was really surprised to see the situation shared by Mr. Cyril about the use of not only nicotine pouches but many other related products. I think Cyril will share with us what are cool lip, what is snooze, what is snuff, and then oral nicotine pouches. So what is the difference between all those products and those who are in tobacco control? It's very important for us to understand what is the difference among them. What are really tobacco products and what are pure nicotine products? So you see, as far as the current situation is concerned, there is not enough information. But as Dr. Gupta mentioned, yes, there are some kind of information which is available if you see some reviews. So we have a lot of information on the characteristics of ONPs. What is the belief, perceptions? What is the toxicity and marketing and sales of these products? Now you see, as far as no public health is concerned, how it is being impacted. So in public health, first thing always comes, what is the magnitude of its use? That is prevalence. So global prevalence, as on today, we are not very sure about its global prevalence, but definitely in many countries, it is really very high. And I will share with you what is the situation. Most of the studies you see information, they are tobacco industry funded studies also. So how much we can believe them, it's really something a challenge for us. But even in countries like US, where the prevalence is really very, it ranges from 2 to 3% among youth and adults population. Sweden, which is considered as home of oral nicotine pouches, where first nicotine or ONPs were manufactured. So situation is very alarming. For example, even in 2023, 2.2 billion pouches were sold, and prevalence really it has become very high, 12%. It's up to almost 12%, and among women, its prevalence is even more. It's almost 15 to 17% prevalence among young women. So it's really very alarming. And you will be surprised to know what is the tobacco use prevalence that I will share with you little later. So in our neighboring country of Pakistan, again, it's a big challenge. So roughly in one of the study which they have done, the prevalence among young people with average age of 20 years, it is almost 17% prevalence, oral nicotine pouches. So it's really something as far as public health is concerned. A new product came very quickly, and so many people are now using oral nicotine pouches. So there are many articles now, scoping review articles which we have, which shows us, which gives us some information, not information about all the countries, but even in a country like US, the almost 40% youth, they are aware, they have heard of oral nicotine pouches, so they are aware of that about the product. No, second aspect, you see, first is always in public health, it is the prevalence. Second aspect, which we know normally every day we are talking, it is about the availability and accessibility as far tobacco is concerned. So again, for this product, it's really something in well last 5 years, the availability has drastically gone up as far as the marketing is concerned, the availability, the number of pouches which are being sold, 15.5 billion units of oral nicotine pouches, and 1 billion, 1 billion is about 100 crore. So 15 billion pouches have been ever sold in year 2023. So huge availability and accessibility of a product is now available. Then there are many manufacturers. I think now, not only earlier, it was only mainly it was in Sweden or maybe in US. So many major companies like British American Tobacco, Malteria, then Swedish Match, which were manufacturing these products. Now I think there are many manufacturers, and we have heard that even in India there are few manufacturers, but they are claiming that we are not using, and that is mostly for export. And the price mentioned on those, which I saw from Mr. Cyril's stock, that is mentioned in Indian rupees. So so I think I would request Cyril to show that in his image, the price mentioned in Indian rupees, 300 something of a pouch of 10 of a packet of a box of 10 pouches. So really, the use has gone up. Third part, which Dr. Gupta ji mentioned about, first is availability, attractiveness, then toxicity part. So toxicity part is again very important aspect of public health. So there are many, still information is not available fully, but in addition to nicotine, flavors, and fillers which are used in addition to sweetener, there are, because the nicotine which comes from the tobacco source, just like in tobacco, we know there are heavy metals like chromium, lead, nickel, and cadmium, etc. So similarly here, in nicotine pouches, although that is not in very high quantity, but all those products are also available. Chemicals are also available from the initial chemical analysis which have been done, including nitrosamines, but in very lower quantity they are also available. So this is about public health. So now, what is the impact? Now you see those who are already involved. Definitely, Dr. Sibia sir will share the individual health impact of these products. But as far as public health is concerned, so what is happening? You see, first of all, this product has captured the addiction market very quickly. And now it is really causing immense suffering and burden to health. Just like in tobacco, we used to talk about health burden. We used to talk about burden to society and economic burden. And economic burden, what is that? So if current market of oral nicotine pouches in 2023, it is about $7.4 billion. $7.4 billion. And our estimates are that by 2030 it will be roughly about 31 billion, and by 35 it will be about $140 billion. So $140 billion people will be spending on this. So huge economic burden it's going to be there uh, if it continues. Then impact on youth. So this is something which is because of flavors and because of taste. And women. Women are especially, women and youth, they are special targets, which is again a major concern. So anything which is impacting women and youth, that is really it's a public health issue. Then dual use. So dual use is also now it's emerging in the name of harm reduction. So now people are using both smoking form as well as or smokeless tobacco along with these oral nicotine pouches. And finally, which is the most important concerning, all of you, when e-cigarette came and many other HTPs, heated tobacco products and new novel products. So what is the challenge with us? No, you see, for the last 2 decades, at least take FCTC. So it's almost now 22 years to FCTC. So there were some gains globally in tobacco control. There were some gains. There were some achievements. But because of all such products, all novel products and so-called no ONPs, they are again normalizing use of such products, such addictive material. So all the gains and achievements we got in tobacco control, so that are being obstructed, they are being hampered because of availability of these products. So that is a major challenge. We were trying for the last more than 2 decades, we were trying to denormalize use of tobacco. But because of this, it is again normalizing. Someone now holding a e-cigarette or maybe oral nicotine pouch, maybe something which may be looking and normalizing. It is all those efforts. So overall, our concern is in public health that in any form, addiction is continuing in this society. This is a major, I think, challenge for us in public health. So this is all in the beginning. And finally, how? For example, Sweden. Take example of Sweden. Sweden's prevalence, they have reduced it to 5% of tobacco use. But because of this now, oral nicotine pouch prevalence is about 12 to 15%. 12 to 15% among youth. So there are all efforts of bringing down tobacco use to 5%. With this now ONP, 15%. This is a major challenge. Similarly, see in Pakistan, the prevalence of Pakistan, that was now roughly 20%. But as I mentioned, among young population, the prevalence of ONP is almost 17%. So 20 plus 17, you can say. So this is a challenge that the people who are doing tobacco control. So now, how much India is doing? So I would request definitely if we have more information. There is not much information available about India, except that a few companies are manufacturing ONP, but they are saying that we are exporting it. But definitely with name, price mentioned in rupees. So that is something I think I would request again, Cyril, to share with us. So thank you, sir. This is in very brief.
So thank you, Dr. Rana. So you told us about the public health hazards of the ONPs, and it is very surprising that 15.5 billion pouches were sold in 2023. So it would be much more now, and $7.4 billion worth of ONPs were sold. So in 1 year, so that is quite challenging. So Dr. Sibia, so I'll come to you. So can you let us know about the harms, the mental health, the dependence or the addiction, and also the cardiovascular health? So about the three major things.
Thank you, Dr. Rakesh, and to the whole CIPHER team, to the chairman, sir, and all the other speakers. I'm really glad to be over here and share some of my views. First, let me just start with something which I not thought about. But what you have been speaking about is the immense amount of money being spent on the tobacco and tobacco products. I think in the biggest disease in India, once we talk of the medical, it is disease. And the biggest disease, the biggest problem in India is not the medical disease itself. It is the poverty. And the tobacco use is really adding a great deal to that poverty, directly and indirectly. Once we are talking about the tobacco and its health issues, about the mental health, what goes in the lips, it actually lands up in the brain. It just doesn't remain over there. Once it goes under the lips, it is very quickly absorbed and it manipulates the brain within minutes. It releases dopamine and other chemicals. Initially, it's a very, very good feel-good factor. And the brain is tricked into feeling that with the tobacco, with the nicotine, a person is able to focus more, he is more calm and is energized. This is one factor which is being exploited when the laborers are given the tobacco pouches intentionally to make them work more, especially in the farm sector. When the brain feels it has a good feel-good factor, but very soon the brain behaves like a spoiled child. And it says, give me another pouch or I will not work. I will not study. I will not even let you sleep. And this cycle keeps going up till more and more and more is used. And this relaxation actually turns into a disguised addiction. And it is not calmness, it leads to the other problems later on, like the anxiety increases, the irritability increases, and the anxiety, irritability, mood swing is felt at the family level. At the society level, there's decreased productivity, there's higher stress. At the national and global level, the nicotine dependence adds to the growing mental health crisis, depression, anxiety, and even burnout. There's a paper that my friend Dr. R.S. Bhatt and I had written in JAPI long back. There was a lady who was working in a canteen, and she said that at times she would have this angina. And she would visit Dr. Bhatt, and he did the ECG. He realized that she's having angina. And then there's a correlation that every time she was down, she was feeling weak, she was feeling fatigued, she would brush her teeth. And after that, she would feel energetic. And sometimes after the brushing her teeth, she would get the angina. And the fact was that the toothpaste she was using had tobacco in it. So once we are talking about oral tobacco, we cannot just limit ourselves to a pouch. It has to be all forms of tobaccos which are being consumed orally. And leaving that toothpaste, she was normal after that. But otherwise, she may have landed up with angiography, angioplasty, stent, and whatnot. The question which people often ask is, Doctor, aren't the nicotine pouches less stressful than the smoking? The answer is no. Remove smoke, but it does not. Removing smoke is not removing the stress, is not removing the harmful effects of the tobacco. So you have to really kick it out and reclaim the peace of mind and live without it. And if you look at the business model is that one pouch is never enough. And this is the business model, which is a very clever trap and a person falls into the trap. But he takes a pouch, then goes to a next pouch, 2 pouches, 3 pouches, and very soon he becomes addicted to it. So the business model is very clear that one pouch is not enough, have another, and carry on. And this is, with this addiction, what people feel is willpower is not actually question of willpower. It's a question of chemistry. So the chemistry is the factor behind the addiction and not the willpower. And ultimate result is the same, that money is wasted. The youth becomes dependent on the nicotine. Creativity is lost. Billions are spent. And globally, it is the same story which is in India. It is repeated again and again. And first the cigarette, then the gutka, then the vapes, and now the pouches. And this is going to come in some form or the other. So we have to be very clear that no tobacco means no tobacco. And this is not a recent problem. It is actually a very old problem, because unfortunately, chewing tobacco in the form of gutka has been very common since many centuries in India. At least 3.25 centuries back, Guru Gobind Singh Ji banned tobacco use by his followers. So that means even at that time, there's the realization that tobacco is not good. But unfortunately, it is still there. So coming down to the cardiac issues, when tobacco is taken, the pouches put in the mouth, the heart starts beating fast. The heart rate goes up. The blood pressure goes up. The arteries get squeezed. And when the arteries squeeze, that means less blood flow. The heart is beating faster. That means more requirement. Is just like a car. You are driving uphill, requiring more fluid. That is heartbeat more, requiring more blood flow. But the petrol or the diesel to the vehicle is decreased due to the constriction of the arteries. So it is a double edge. The requirement of the blood flow to the coronaries goes up, and actually the blood flow decreases. The requirement is more, demand increases, and the supply decreases. And this ultimately leads to all the angina and other issues. Here again, I'll give you a personal experience with a patient. This patient was being put up. I'll just cut it short. He was being put up for a bypass surgery in Delhi, in one of the leading hospitals. This incident is around about 20 years back. And since he did not want surgery, he was being pushed into the OT operation theater when one of his relations over here, his father-in-law, so he decided to postpone the surgery, and he came to us. And we did a detailed analysis. He was recently married. His wife told us that on the day of the angiography, he had smoked at least 50 cigarettes. And that 50 cigarettes meant that his arteries had really narrowed down at that time. We told him, just go back for 1 or 2 months, do not smoke, and you come back again. He came back again. We did have the stress helium done, and his flow was absolutely normal. So this is how harmful it can be. How many persons who take a lot of cigarettes, smoke a lot, or take the cigarette and pouch are counted at the same level. They choose the tobacco, they choose the pouches. And when they have the angiography done, they show severe blockages, triple vessel disease. We are simply stopping that could have saved them from all the procedures. And India already, the number one killer is the heart disease. And with tobacco use, with the addition of the pouches, this epidemic is only going to increase.
Yeah.
Worldwide, with 18 million deaths every year, we can imagine the money which is being spent, the man hours which are being wasted due to the heart disease, which is further pushed ahead with the pouches. So it is not just the addiction it is also not just the heart disease, but it's also the false positive test results which are caused by the pouches, which we have to take into care. So this false positive can be decreased if there's no smoking, absolutely no smoking, or at least for a week before the angiography, stop smoking, and many patients will be saved from the false positive results, which ultimately land them up on the operation theater in the bypass.
Yeah. So thank you, Dr. Sibia. So
Yeah.
I think tobacco also contains nicotine. So
Yeah.
whenever he talks about tobacco, he means nicotine, actually.
Yeah.
And an anecdote about Dr. Sibia. Dr. Sibia is known to me since 30 years, more than 30 years. And he was about to be marketing. He wanted to market electronic cigarette. And when I told him that what are the harms of the electronic cigarette, he stopped those. So Dr. Aruna, she told that there is oral gratification also with the nicotine pouches, so that exaggerates the dependence or the addiction part. So about the cardiovascular system, I think he talked about the constriction of the arteries, then raising blood pressure, then raising of the heart rate also. So now I'll come to Mr. Cyril. Mr. Cyril, are you with us?
Yes, sir.
Okay. So Cyril, Dr. Rana actually told me that you have found many of these oral nicotine pouches in the points of sale, or even online you have bought it. So can you tell us about the availability of the oral nicotine pouches at points of sale, and about the online sale of the oral nicotine pouches?
Yeah. Thank you, sir. Thank you for the opportunity. Maybe you can allow me to share some of the pictures.
Yeah, sure.
Maybe the presentation, maybe.
You can show the pictures.
Yeah. How it works. Can you see me? Can you see the presentation?
Yes, sir, we can.
Yeah. See the in future marketing for a tobacco, nicotine,
Sorry, if you can just go full screen, sir.
Yeah.
Thank
the
you.
electronic cigarette and nicotine pouches. These are the two products going to fulfill the entire marketing in India and all the places actually. So fortunately, we have banned electronic cigarette, but the nicotine pouches is not. So the nicotine pouches are very much available in online now. Maybe it's not available point of sales, but there are some issues with point of sales, but it's very much available in online. So you can purchase it through online. There are two types. One is Indian based companies, and then foreign products. The product is from foreign, but the Indian companies, they are getting the wholesale, and then they are doing local marketing in India. So you will be you can order it through the online, and then you can get the products in your doorstep. So that's the thing now. And then we also ordered some few products. We are able to get the products, and then the pricing from 300 to 3,500. It will be varying from the rate will be varying based on the Indian market actually. Now it's available in boxes, but it definitely when it's coming to the Indian market, it will be available in pouches, the small packets also. The nicotine pouches will be in a small packets also, like other gutka product. So that's a danger of that. And then see, this is the tracking, how we place the order, and then how we are able to get the products. So you can see Dr. Rana also mentioned that the Indian rupees, that means they are getting the product. We don't have manufacturing unit in India, but still they are getting the product from other countries, especially Sweden and other places, and then they are it's like a distributors, in Indian distributor, and then they are sending the product from the from India, and then through Amazon and all the platforms they are selling this product. So the inside the thing, it will be like this, and then it's like pouches, small pouches. You can see the various rates also. It's starting from 300, You can see the tracking. We can track the product and then when it will be available and all these kind of things. We can get the product within 2 days, or sometimes it will take 1 week. Sometimes the next day itself you will be getting the product. So paid in other currency. If you are ordering from other parts of the country, that's also it's possible. And then now we don't have any act to reduce or ban this product, so it's easily it will reach to your place. So it will come around 3,000 or 5,000 rupees, and then we ordered through. So Sweden is the hub for all these nicotine pouches, especially for Indian orders. They are dealing it through.
I think his frame is freezed. Dr. Pardeep, can you do anything about it?
Sir, I think it is
Mr.
an
Cyril,
issue from his end.
Cyril, are you available?
Mr. Cyril, you can switch off your video on. So please continue on presentation, but switch off your video.
Sweden.
Cyril, okay. So I think he's disconnected. Maybe we can give him a minute to join back.
Okay, sure. We can give him. Actually, Cyril is doing an extremely good job regarding this. Yeah, Cyril, you can continue, please.
So if you can switch off your video, I think it'll just be better in terms of network connectivity. Also, sir, you're muted.
Okay.
Cyril, can you unmute yourself, please?
Yeah. Just I will show you some of the.
And switch on the video also. Switch on your video. Your own video.
Yeah, it's on now. Yeah. Okay. See, maybe I'll show you. This is the product that's available in India. The manufacturing unit is in India. It's snus. It's not a nicotine pouch. It's a snus. You cannot identify which is snus, which is nicotine pouches. That is another danger. See, you can see this thing. Cool lip is completely from tobacco product. So you will find 3 to 4% of the nicotine in the cool lip product. And then next one is the snuff everybody knows, and then the color also. From the snuff, they are creating this snus is nothing but snuff. See, like white cigarette, white sugar, they are adding more chemicals and then making into white. So the snus is manufactured in India and then they are selling it in Sweden and other places. But through online, you can able to purchase the snus in India. So that's why we got the snus in India. And then we have a doubt. The snus is having a pictorial warning, the Indian pictorial warning. It's nothing to do with Sweden, but they have an Indian pictorial warning. So I think it will be available in the point of sale also. And then we can see the nicotine pouches. The nicotine pouches is it's exactly the cool lip product. See the pattern. The cool lip, snus, and then they are moving into nicotine pouches. So the nicotine pouches, you are able to get it. See, I can show you some of the products also. This is this one, and then the white gold. It's sorry, it looks like an advertisement, but still, the dangerous thing is you can see the 50 mg. 50 mg. So you can see the 50 mg nicotine pouches. One pouch is 50 mg nicotine pouch. If your cool lip is 2 to 3% or 3 to 4% of nicotine, but here the single pouch is 50 mg nicotine pouches. It's very dangerous. And then you can see the pictorial warning of Indian pictorial warning in the snus product. why they have a India pictorial warning? If they are selling it only in Sweden, why they have this kind of Indian pictorial warning? That's also the thing. Because what happened? No, how the tobacco industry is manipulating it. It's also the very important. If you are able to control under the Tobacco Control Act, they will say it's nothing to do with tobacco. It's a synthetic nicotine, so it's not comes under tobacco. What happened in Sweden? They banned the nicotine pouches. What they did is they add some few tobacco products. They exactly the same product. No, the pouches are same. The white powders. So they add tobacco into it, and then they said it's a tobacco product. So if you say tobacco product, they will say nicotine. If you say nicotine pouch, and then they will say tobacco product. So always they will manipulate like anything. These are the possibilities of manipulating, and then really we have to come up with some standard act for this or ban all these kind of things. So the marketing in India is very much it's open, and then the people are the so far it's not available, but still it's in very soon we will get this product with our children's hand, I think. So really we have to be very careful, and then we have to do these things. And then the influencers, social influencers, they are playing a major role on it. They are the one who promoting these kind of things, and then they are the one who exploring all the possibilities to reach to the children. So and then the
Dr.
marketing.
Cyril, please excuse me. I was going to ask you about the influencers
Okay.
in the second round. Yeah.
Okay. Okay. Thank you.
Okay.
Then. Thank you. Thank you.
So, Dr. Advocate Ahooja will be joining us. So, yeah. So, Advocate Ahooja, actually, he's the ex state drug controller or the Joint Commissioner of FDA in Haryana. So, he'll be telling us about the laws which are by which we can, curb the menace of the oral nicotine pouches. So, sir, under which regulation are oral nicotine pouches permitted? And if ONP is not approved as food, under which food safety regulation are these prohibited? And nicotine is covered under the list of poisons. So you'll be telling us about all the laws, all the three laws related to it. Yeah, thank you.
Thank you very much for inviting me and expressing my views on this very particular topic and disturbing topic for the youth. Basically, as far as Indian law is concerned, it is totally banned under Food Safety and Standards Act Regulation 2.3.4, which clearly states that no food product should contain any nicotine or tobacco being injurious to the health. This is the exact line which is mentioned in this particular regulation, and it is banned in India for manufacturing for sale, even import. As far as the import is concerned, it is banned, but it is not very much enforced. This is the tragedy in our country. And Drug Act, it is not approved as a drug. If we say that nicotine pouches, they claim that this is used for the cessation of cigarette, then it is covered under the definition of drug as given in section 3B of Drugs and Cosmetics Act. That it is preventing something, but it is not approved by the Drug Controller General of India as a new drug, and ONP is not a drug at all. Therefore, any claim made by any manufacturer in India or from imported outside from India is a wrong claim, and it is a banned, not approved, unapproved drug. Now, if it is unapproved drug, then it is a violation of Section 18C of Drugs and Cosmetics Act, which is punishable under Section 27B2, and it can range up to 3 to 5 years and minimum of 1 lakh of fine in under Drugs and Cosmetics Act. Poison Act, it is listed, nicotine is listed as a poison at serial number 20 of the list of poisons under Poisons Act 1990. I still remember the guidance we got from Dr. Rakesh Gupta at that time when we were fighting this particular case, and we submitted our affidavit in the Honorable High Court of Punjab and Haryana. And Punjab also banned. Prior to us, we banned. Dr. Rakesh Gupta knows this thing. As far as the law of other countries is concerned, just one more thing here I want to say. If it is a poison, then it cannot be sold to the children, and it is punishable offense under JJ Act, and the punishment goes up to 7 years. And for other countries, it is very strange. United Kingdom, that is Britain, they allow them, and it is legal, and it is a consumer product, but sale can be done with certain age restrictions. And Sweden, again and again, this name was coming, and the product is coming from Sweden. It is legal. It is legal for snuff, snus, and pouches. I think Sweden is earning money out of it, and they are not caring for the public health. Germany, it is totally illegal and banned under food safety regulations. France, it is illegal and recently banned. Belgium, it is illegal, completely banned. But United States, very strange. Otherwise, they say their regulations are very stringent. But in this case, ONP's case, they are legal, but FDA regulates as it as a tobacco product. Canada, it is heavily restricted but available. Australia, it is illegal, but sale is allowed with prescription only sale, as if it is a Schedule H drug in our country. And India, it is completely illegal under various acts, which I have already told you. But again, I don't know why and how. The enforcement is really poor, and Dr. Gupta has framed very fantastic recommendations to the government and might have been sent also. South Africa, it is legal with very limited regulations, and it is available. Brazil, it is illegal, it completely bans it. But again, lastly, Mexico, it is legal and hardly any regulation, and it is very commonly available. Now, import, sir, for any product to be imported in my country, it requires to obey the law of the land, that is law of the regulation of my country. But again, the enforcement is very poor. It is available on online platforms, and online platforms generally controlled from other countries, and it makes the product which is banned, illegal, prohibited for having such stringent penalties, but available in our country and ruining the youth. That is the legal position, sir.
So, Ahooja sir, I'll come back to you with
Thank you.
some other legal issues also.
Yeah, definitely, sir.
So, back to Dr. Rana. So, Dr. Rana, can you tell us about the environmental harms which may be caused by oral nicotine pouches?
Thank you, sir. Thank you very much. So, as I mentioned earlier, the amount, you can say 15.5 billion units were sold in 2023. So very quickly. So definitely there must be some kind of environmental burden of oral nicotine pouches. In the past, we used to talk about environmental burden of tobacco, which includes deforestation, which includes damage to soil, which includes environmental burden because of litter caused by tobacco products. So here the situation is almost coming out to be similar. For example, so there are various sources of environmental burden of nicotine, oral nicotine pouches, and one definitely at the stage of manufacturing. You see, during the manufacturing, and many chemicals, they including nicotine, they are released into the environment, soil, water. The process which we often called as leaching. So leaching of these chemicals into the environment, mainly soil and water. So that is a major environmental burden. Then disposal of pouches, 15 billion pouches, you can imagine. If they are not disposed properly, you people must have seen the cigarette butts on various sea coast, and lakes. So that is the same situation will be there, although we are not having enough again, studies or surveys done for oral nicotine pouches, but because of this disposal, there can be many chemicals, nicotine, which can go into the wastewater system, septic tanks, and directly into soil and water. So this is about the harm. Physical waste, pouch material, that pouch under you, just Cyril showed a few pouches, which are made of cellulose granules. There are some kind of binders, flavors, and so these pouches have also lead to plastic and microplastic pollution. So this is another dynamics which is now emerging as far as oral nicotine pouches are concerned. Then packaging. You must have seen the boxes which were shown by Mr. Cyril. So 15.5 billion such kind of plastic, which I saw with from him. They were mostly they were plastic. So either plastic or tin boxes in which these pouches 10 pouch box, 15 pouch box, 20 pouch. So huge number of boxes of plastic or tin. They will be thrown into this environment. So this is something which is again very concerning. Then ecotoxicity is again very important. Earlier we used to talk about the cigarette butts. When cigarette butts are thrown on the ground and when they become wet, then the chemicals, all those chemicals leach out from the cigarette butt. And now same is the situation when this pouch after use that will be thrown. So there will be definitely impact on organisms. Harm on organisms can be there. Then there are many other chemicals and heavy metals, just like in tobacco products, in the form of cadmium, lead, which are carcinogenic if they are released into the environment. So overall, I would say very briefly that right now there are not big studies specifically done on oral nicotine pouches or surveys, but these are some initial analysis or initial information which is right now available as far as environmental burden of oral nicotine pouches is concerned. So thank you very much, sir. Over to you. And any addition from colleagues?
Thank you, Dr. Rana. Yeah, I think you have covered all the, harms of the environmental health. So over to Dr. Sibia. So I may let you know that we are co-authoring a book with Dr. Sibia. So that is Save Yourself from Nicotine and Save Your Heart. But the name may be changed. So it will be available free on Kindle. So Dr. Sibia, will you be telling us about the effects of oral nicotine pouches or the nicotine on reproductive health, the respiratory health, the cancers, the oral health, and if there are any other health harms? Thank you. You are muted. You are muted.
When we are talking about the nicotine pouches and such products, the most important thing to remember is that they are not only toxic, they are also decreasing the circulation, not just to the heart, but throughout the body. And once we talk about decreased blood flow throughout the body, it means that they are going to affect us from head to toe. The cerebral ischemia, brain strokes, eye problems, heart of course there, lung of course there, kidneys affected, and the peripheral artery diseases more. It may lead to gangrene, it may lead to amputation. And in the same series, when we talk about decreased circulation, it also reduces the fertility in both men and women, and it harms the placenta, it lowers the oxygen supply to the baby, to the fetus, and it increases the chance of miscarriage and premature birth and low birth weight. So we are not just destroying our today, we are also destroying our tomorrow. Uh, the families who are dreaming of having babies, they may be deprived of that. Nations who want a healthy future, they are going to, with the nicotine pouches, right from birth, the problem starts for the next generation. And it is not a question, sometimes because the nicotine pouches is also becoming a fashion. So it is not just a question of uh, the people taking it. Sometimes the young ladies ask that, can I take an occasional nicotine product, nicotine pouch or any other? We should remember that there is no safe dose for it. And even a small amount of decrease in the oxygen supply to the baby can be a disaster. So happy families start with nicotine-free parents. So that is where we stand. For respiration, it increases the sensitivity of our lung structure, and it increases the vulnerability to allergic diseases, to infections, to pneumonia, and to tuberculosis and everything. Once the blood flow is decreased, we are going to have all types of problems, and decreased immunity is going to lead to everything. And of course, the cancer is over there. And that is one of the most fearful cancers you see. Well, other cancers are suppressed. Suppressed means that they are not visible. But there is one cancer which becomes clearly visible because once it is in the oral cavity, which is affecting the jaws, the lung, the jaws, your tongue, your cheek. So it is a very pathetic, and a person cannot even show himself in public. And of course, once we have the decreased blood flow and all, the other metabolic effects, like effect on the diabetes, weak bones, weak effect on the kidney, it is a disaster everywhere. So one single thing I'll say is that the future of health depends on three things. One is good nutrition, other is being toxin-free, and the other is having good circulation. And this is affecting all three of them. So we must avoid it at any cost. We have to save our hearts, we have to save our lungs, we have to save our families, and we have to stop our nation, save the nation. And for that, it is important to stop this habit of nicotine pouches because before it becomes the next epidemic. Thank you.
Thank you. So, thank you, Dr. Sibia, for letting us know about the harms of the nicotine. So, I may let you know that Dr. Jagdish Kaur has joined. She is our chief guest. She is a regional advisor, Tobacco Free Initiative, WHO Regional Office for Southeast Asia. And we also have with us Dr. Sherko from Iraq, Dr. Aruna, Dr. Rakesh Gupta is from the Rajasthan Cancer Foundation, Mr. K.C. Sani, Rajiv is with us, Dr. Ram Prasad is with us, Dr. Siddhi is with us. So I'm sorry if I have missed some names, important names, but so I acknowledge the fact that we have with us many public health specialists. Yeah, thank you. So over to Mr. Cyril. So Cyril, can you tell about the influencers? Now you can tell about the influencers. And have you ever bought, and you have already told that you have bought these products at online. Have you bought them at points of sale also?
At present, it's not available in points of sale, but maybe somewhere we have to check that part. But online, it's available. And then the social influencer, no, they are playing a major role on it. See, you can see many videos and photographs and all the advertisement materials are available in Instagram and the other social media. See how they are promoting it. Like they are not only using it for oral purposes. They are just opening the pouch and then they are adding it to their cool drinks and then they are drinking. And then they are adding it to their cake and ice cream. They are consuming this product. So like that, they are giving. They are come up with many advertisements and many social media reels and other things also. So if the product is coming into India and then if it is available and in a point of sale, the reach will be like anything. I don't think we can expect how the reach will be. Within 10 days, it will reach to all the places actually. So like that. So the social media influencers, they are very much with many reels and then the marketing strategy also it's changed and then the availability also changed. No need to go to the shops now. They can stay in their own places. Even they can be in the hospital or school or in the home. Still, they can get the products. They can through online. They can just get the products in their home itself. So that kind of marketing strategy also changed now, and then packaging things also changed, and then the influencers also playing a major role.
Okay.
Thank you, sir.
Yeah, thank you. Thank you, sir. So over to Mr. Ahooja. So, sir, what action can be taken by drug control officers? And ONP claims cessation of smoking if the claim covers ONP under the definition of drug. And please tell if ONP is approved as a drug by CDA, SC or DCGI for marketing in India. And if an ONP is an unapproved drug, then what is the violation and the punishment? So all the
Sir,
questions you can answer. Yeah, thank you.
sir, ONP is not at all approved by the Drug Controller General of India, CDSCO, and ONP is not an approved drug in India to be used, and it is very much wrong claim made by the ONP manufacturers that this is used for the cessation of cigarette. I am again reiterating this fact that this claim is absolutely wrong, as this claim put this product in the definition of drug, and it is a violation of section 18C, punishable under section 27B2, in which it is punishment is prescribed from 3 to 5 years, and the drug control officers can seize this drug, taking that this is an unapproved drug. But basically this is a food also, because they are taking it as in the mouth and keeping it in the mouth for 15 minutes to 45 minutes and the consuming it as a food. Then it is not permitted as a food also, regulation 2.3.4. Then it is unapproved food or prohibited food, then action is again required to be taken. Sir, basically this is not the problem of law, but this is basically a problem of enforcement.
I
And
agree.
I'm really sorry to say that this is problem of enforcement, and we have to put pressure on that part only, that the provisions which are already existing should be enforced properly, sir.
So thank you, Mr. Ahooja, for letting
Thank
us know about the legal aspects of
thank you.
using ONPs. And we have actually already sent some recommendations.
Yes, sir.
So
That
after
contains
consultation
that
with Dr. PC Gupta and you also,
yes, sir.
so and with the Mr. Cyril also. So we
Yes,
have sent some recommendation. Maybe these are taken up, and the enforcement of the law. That is the basic thing.
enforcement of
So,
the law, sir. That's the basic.
so we are actually struggling with that PICA Act also
Yes, sir.
against electronic cigarettes. So thank you,
Thank you.
Dr. Uji. And over to the Eco India, the Miss Paridhi.
Thank you, sir, and thank you to all the panelists for sharing their ideas and their insights into this very severe problem.
Dr. Paridhi, can we have a snapshot now? Actually, people are more
Yes,
now.
yes, we can. We can. If everyone can again switch on their cameras and smile, that'll be great. Big bright smiles, everyone.
Dr. Jagdish, the upper part is Acha, okay. So you have WHO logo there. Okay.
All right, 3, 2, 1.
Yeah.
Right. I'll just take one more. Thank you.
Yeah, thank you.
Thank you. So thank you to all the panelists, and I would now like to just give me a second. I'll just share my screen. So I would now like to so should we do the question?
We can ask for questions if there are any.
All right. So I would like to call upon Dr. Opinder if she can take the question answer section. Ma'am, if you can.
We really don't have any questions in the chat box, so I would request if any of the participants have any questions, so they can put it on the chat box for any of the speakers.
So we have Dr. Rakesh Gupta with us. He is always ready with questions and guidance for us, actually. Dr. Rakesh Gupta, please.
Thank you, Dr. Rakesh, and greetings to all friends and colleagues and mentors. I don't have a question, actually. It's a perplexity that we are facing.
Yes.
And as everybody has sounded, it's a bigger bluff that we are going to face from the tobacco industry. And my response to this is end game only. We have to work on it. We should not feel shy of it. And I think we should keep talking more about that. There are no other solutions. And there is a need for amendment of the acts which are there. And can we make it one act? And that is all that I wish to say, that it may appear impractical, but eventually this is what is going to happen, whether it happens in a few years, whether it happens in a decade or more, but it has to come. That is what my comment is, briefly.
And we already have many of the legal framework, actually. We have a legal framework with us in India to curb this menace, total nicotine pouches. Now we have a very comprehensive act against electronic cigarettes, but we already have these acts against the oral nicotine pouch. And may I ask Dr. Aruna if she can tell us about the oral health harms of ONPs?
Sir, actually, any of the tobacco products, the smokeless tobacco products or the nicotine products, it again depends upon the site placement. So of the quid or else the pouch placement. So in the long term, it may affect the gingival periodontal status, and as well as the even the it will be too early to say the cancer risks and all the oral cancer risks, and all still the studies had to be done. And as far as the nicotine is concerned, again, it has got the generalized inflammation, so it applies even to the oral cavity as well. So
I may tell you that we have Dr. Bijit and Dr. Ramprasad also with us. Yeah.
Periodontal attachment loss is there, tooth mobility, and
you're right, Dr. And we have Dr. Bijit and Dr. Ramprasad with us. They got this year Tobacco Control Award from CIPHER. So big applause for them. And I may not be able to take their comments. So over to Dr. Paridhi, please.
Thank you, sir. So moving on to the next section, which is the special address by our chief guest. I'll just share my screen. So I would like to introduce Dr. Jagdish Kaur, who's the Regional Advisor for Tobacco Free Initiative under the WHO Regional Office for Southeast Asia. She is currently working with WHO, but she has previously worked with...
Can you hear me?
Yes, ma'am, I can hear you.
Thank you so much. I think that's fine.
Okay, all right, ma'am.
Go ahead. Thank you.
Can you be louder, Dr. Jagdish? Can you be louder?
Just a minute. I'll just check my volume. Is it better now?
Better, but still, it can be still better.
Oh, because then I'll have to wear my headphones.
No, now it's okay. Yeah.
Okay.
Just now it is better. Yeah.
Okay, thank you so much. So thanks so much, Paridhi. Thank you, Dr. Gupta. A very good evening to everybody, esteemed panelists, speakers, organizers. I think it could not be more timely because we need to talk about nicotine pouches moving ahead from other products and electronic cigarettes. A lot has been happening globally, and this is a problem in many of the countries and many of the regions. And I think we spoke about in the panel discussion that products are available online and there are many social media influencers. So that's itself, we should understand the severity of the problem, which is already there. Taking into, account all that, we know how the industry kind of they play this various products. It is the digital marketing, it is the sponsorship through the popular events, which are popular with the youth especially, and the flavors. So the game of the flavors, they have taken this forward from the electronic cigarettes now to the nicotine pouches, and basically to counter the smoke-free policies, because countries were implementing their smoke-free laws, smoke-free policies. So this nicotine pouch introduction is a counter to that, and also targeting the youth basically. So this is why WHO again and again we focus on this aspect, and most of our World No Tobacco Day themes also, they are taking into account the youth aspect. Uh, I just want to flag one issue. If you guys have heard about the zombie vapes, because recently this has come from the Western Pacific region and one of the our tobacco testing laboratory. So these are also called K-pods, and they are very popular in Singapore and some of the Western Pacific countries. Earlier they were there in New Zealand and Canada. So they contain etomidate. So that is a anesthetic agent. So similarly, like they misused electronic cigarettes, nicotine pouches can also be used that way. You can put drugs, you can put other things, and this happened in Singapore. So now Singapore is regulating the ends as the vapes as the drugs. So they have, a very kind of very strict regulation they are doing, because this was going on and this was going on increasing. So we need to be very vigilant, because here, like if you don't regulate, they can put anything in these nicotine pouches and that can be provided, especially to the children and to the youth who are liable. So we need to be very vigilant about that. And we spoke about many things, and it was also mentioned, there are already many acts. We have FOTPA, Drug Act, Food Act. So whatever regulation which we have, which could be used for regulating these nicotine pouches, that needs to be done. Please send specific recommendations to the government, to the policymakers, so that they can take timely action. And we also heard about, I think the end game. I mean, that's very ambitious, because kind of we spoke about that tobacco, and now we have two epidemics now, because we already have tobacco epidemic going on, although the curve is bent now, but then the nicotine has taken up. So now we have tobacco as well as the nicotine products. And I think the availability online, and these are more dangerous than the, ends, because like smoking and smokeless tobacco, we had that issue, but now ends versus nicotine pouches. So on request of many countries in the region, regional office is now coming up with a regional plan. We are coming up with a framework to deal with the this smokeless tobacco, areca nut, because that is also nobody's baby, and then the electronic cigarettes and nicotine pouches. So this will be presented to the regional committee meeting, which is happening later in October. That to be endorsed by the member states, and then this will be shared with all the countries for implementation. So I think that is very timely to focus again on, I think, to reiterate on the smokeless tobacco areca nut, as well as electronic cigarettes and nicotine pouches. So we'll share with you the framework once this is endorsed by the regional committee, and requesting everybody's help, so that, countries are supported for implementation of the framework, and they have to report back on some key performance indicators. So that is required. And of course, the role of civil society cannot be undermined, because at the grassroots we need action, and that has to be, done with the help of and support of the civil society, which is, in India, it is very proactive, very vigilant. But I think every day there are new challenges, and we need to deal with those challenges collectively. The government, the regulators, the civil society, other partners, stakeholders, everybody together. Because like tobacco, this nicotine epidemic also, I think this has to be kind of, we have to see it as a big threat. And the forthcoming conference of the parties meeting, which is scheduled for November, there also, these things will be discussed in detail, and we'll get more guidance from the COP as well as the MOB, because India is also party to, the protocol. So I think a very important discussion and very important points were discussed, and everybody, made very relevant interventions. And good to see that. And this should not stop here. We need to move forward from here, and we need to kind of, follow up very closely with the policymakers, the government, that, these things are coming up and how they are going to deal with this, along with the, Ministry of Education and other stakeholders, because we need to work with them. These things, they are being sold online. Children have access to that. They are being sold near to the schools. And I mean, many states, we hear every day that some instances, coming to our knowledge that these things are happening, and how, in fact, I think already they are mixing things with this nicotine in
Yeah.
pouch and something, and children are consuming that. So that is a very, very, I think, a serious issue, and we have to look at that and kind of form strategies, very specific targeted strategies, how to deal with that. So these are few points from my side, sharing with you some of my thoughts. Thank you so much for the opportunity. Over to you.
Thank you, Dr. Jagdish, for concluding it very comprehensively. And I must appreciate the very nice background you have, and the proud to be WHO. So that is very nice. Yeah.
Thank you.
Thank you. Over to Dr. Paridhi.
Thank you, sir. So we move to the last, and thank you, ma'am, as well for your remarks. We will move to the next section, which is the last section. I would invite Ms. Opinder Gill to give a formal vote of thanks and concluding remarks. Ma'am, over to you.
So thank you so much. I think all the panelists and Dr. Jagdish have very nicely and comprehensively highlighted the issue that we are facing in form of emerging products. It was very rightly said by Dr. Jagdish that we had a tobacco epidemic, and now we have a nicotine epidemic, and the enforcements and the policies need to really strengthen up. So I once again thank all our panelists, Dr. Ahooja, Dr. Sibia, Cyril, and Dr. Rakesh, Dr. Rana, Dr. Rakesh Gupta for highlighting the need for endgame, and a very warm thanks to Dr. Jagdish Kaur for taking out time to be the chief guest for this very important webinar. And to conclude, I think we could just say that we all need to work hand in hand, and we need to fight this menace and make very stringent law, and also ensure that these laws are enforced in the best of practice. We have our youth's future at stake, and I think all of us working in tobacco control and nicotine control are working towards creating a safer environment for our coming generations. So thank you one and all for joining this very important webinar, which was organized by the Tobacco Control Section of the Union. I once again thanks everyone for taking out time, and we look forward to a combined effort and activities towards reaching to a place where we can actually create a safer environment for our future generations. So thank you so much, everybody, for taking out time.
Thank you all
Thank
for
you.
being very good participants and listening to us patiently. So thanks all. Thank you. Thank you, ma'am.
Thank you, everyone. I'll
Thank
be closing the webinar.
Thank
Sure.
you.